Good evening, and welcome to the Rhythm Notes of Health with me, Kai Ienta. I am the soul of public health. I am excited about today's topic. It is probably one of my most requested topics, and I get the most answers, questions, I should say, too, and that is vitamin D. So I am saying vitamin D, the diamond nutrient. You will see why I'm calling it the diamond nutrient, why it's important to you. And without further ado, we're going to bring in Dr. Monica J.R. Williams Riley and get this thing started. Let's bring her in. Dr. Monica, how are you?
I am good. How are you?
I am well. Thank you so much for joining me this evening. Let me do an official welcome of Dr. Monica J.R. Williams Riley. I'm so excited to have you with me tonight with Black Pink. And as I said, when I reached out, because we've talked about vitamin D a lot of times. So I've officially coined you the vitamin D doctor. So that is your official name, because we can never get too much information about this particular topic. Hence is why I have named it vitamin D, the diamond nutrient. And as I was telling everyone, they'll understand why. So Dr. Monica, in which I'll be calling her, Dr. Monica, tell everyone who you are and how they can get in contact with you, because we're going to tell them now and we're going to tell them at the end to make sure that they get it.
Absolutely. Thank you so very much, Ayanta, for inviting me tonight. I'm just so happy to be here with you, especially speaking about a topic that I love so dearly. Well, first, a little bit about myself. I'm a proud graduate of Tuskegee University,
yes,
and also a proud graduate of Meharry Medical College as well in Nashville. And I've been in medical practice for a little over 25 years now. I'm board certified in family medicine with emphasis in wellness and functional medicine and integrative health. And so I spend a great deal of my time now working with my company, Deep Rooted Health, I guess full-time now.
Yeah.
I'm so excited about that.
Congratulations.
Thank you so much. Thank you so much. And it's really wonderful to be doing what you're passionate about all the time. They said, if you do what you love, it's not work. So
it's not work.
I'm getting to that point. I'm getting there.
Yeah.
So yes, I have two locations that I work out of. I work in Decatur and another location off of Dunwoody, and really enjoying seeing patients and doing wellness work and getting people back to the root of their health.
This is why it's deep rooted, right?
Absolutely.
That is wonderful. I always tell people that the what I'm excited about with the team of physicians that I work with is that everyone approaches medicine as a holistic approach. That's important for me when vetting. I mean, I literally get doctors referring other doctors to me all the time. And when I talk to them, if they're not looking at us as a whole with a holistic approach, I really don't want to work with them, because it's important for me that doctors understand that all things are connected. And so that's one of the things I like about you, Dr. Monica, ever since I've met you. That has been you, your energy, your spirit that you put out is a wholeness approach. So thank you just for giving your service. Let me just say that first.
Oh, well, it's my pleasure. And it's so interesting because it even baffles my mind, as I say, 25 years in the business. But it's always been a passion of mine when we talk about medicine, that it be about the whole person. It be about the whole child, that it be about the whole woman, that it be about the whole man, that it be about the whole elder. Because without that, we're really just putting Band-Aids on things. And so the root of disease, the root of health, is about the whole person and getting to the root of the thing. So that's what I love to do. So I'm happy to be here.
Y'all heard Dr. Monica say dis-ease. Y'all heard her. That's how you know we connected, because y'all, if you listen to my podcast, you know that I always say dis-ease. And so the fact that you just said that and I didn't even say it first, I love that. Okay, we're joined by our roots. Absolutely. So Dr. Monica, we are doing a vaginal health and sex series for women. And as I always say, the men, you got next, because we have urologists and we have next with the men. But we have talked about a lot of topics, including bacterial vaginosis, vaginal dryness, can menopause ruin your relationship, yeast infections, middle-aged women in sex, and age appropriate behavior. We've talked about masturbation. We've talked about mental health roadblocks in sex. And I have been really just in awe at the amount of people that are just listening and clearly wanting someone to talk about these topics. But as we've talked about all of these topics in vaginal health and sex, I have gotten so many questions about vitamin D. And so I had to come back and add that in. Like they said, the women's series is never going to end. You're going to always have to add something in.
Always something to teach.
Yeah, but I'm a person who wants to get it right. And if
Yeah.
I'm not addressing what everyone wants to hear, right, then I'm not doing a service to women and their understanding of things. And so today we are going to be talking about all things vitamin D. And the importance of this is that everyone is talking about vitamin D. It's become this popular vitamin that you talk about.
And it's well suited that it should be. Yeah.
Yes. And so that's what we're going to talk about. We're going to talk about the importance of why this, that's why I call it the diamond nutrient, why it's called the diamond nutrient, why it's important, why we need it, what's too much. You don't have to think about remembering all these questions, because I'm going to come back to them, but just wanted to give a synopsis of our direction and what we'll be going into. So the first thing I want to talk about, because it's important to me that people understand yesterday so they can understand today and tomorrow, right? So the first thing that we want to talk about, and Dr. Monica, I was reading, because I try to do a little scholarly research in preparing for these. But as I was doing some research about vitamin D, the first thing that I read is that it started to talk about vitamin D as being a hormone, right? Mm-hmm. And so you can talk about that specifically, but I wanted to bring that up. And then it started to talk about where the word vitamin came from, and that it didn't necessarily come from a holistic approach. It came from the medicine side. So if you have information about that, to just kind of talk about that, to give us a history of vitamin D. So let's just start with the history of vitamin D and why it has become popular.
Well, the place that I come from with vitamin D is when I'm educating my clients about vitamins in general, mm-hmm. I like to talk about, and maybe the science of it, in the sense that, A, B, C, D, we have a whole alphabet of vitamins, and most people don't quite know why we even take vitamins. Mm-hmm. Some people think they take them because their mama told them to take them.
Yeah.
Some people take them because they think it makes them hungry, or some people don't take them because they think it makes them hungry. Yeah. I will tell you that, we learned about vitamins way back in med school, and mm-hmm. We were in biochemistry, and they were teaching us about these things called coenzymes. And coenzymes are the things that make a chemical reaction happen. So an enzyme is something that you put in the middle of something to make something go. Mm-hmm. And so a coenzyme is something that causes you to break a bond. And when you break a bond, you make energy. So little did I know at the time that what we were really talking about was a whole area of nutrition. Mm-hmm. Why do we need these coenzymes, AKA vitamins?
Mm-hmm. So Dr. Monica, let me just stop right there, because I like to educate, and I know there are people are laymen. So I just want to stop and educate them just for a second on enzymes. So you can't say you're not learning things on this podcast. We're going to empower you, and you're going to learn something new. So let's just go back to enzyme. And because that was very powerful what you said. So you tell us again what enzymes are and what coenzymes are.
So when you have an enzymatic reaction, and I don't like to talk over people's heads, so I thank you for going back. Yes. So these are things that cause reactions to occur. Mm-hmm. So to have that reaction to occur, sometimes you need something in the middle, mm-hmm. something to make the spark, if mm-hmm. you will, just trying to simplify it. And so with two things happening, something in the middle to make the reaction happen more efficiently, mm-hmm. is what a coenzyme would be like. And so vitamin A, vitamin Bs, the C's, the D's are all looked at as coenzymes. So
Okay.
vitamins in general help reactions to happen.
Okay.
I kind of tell people that it's like eating food.
Mm-hmm.
Food can be calorie, but if you want the energy out of your food,
Mm-hmm.
then the vitamins are there to help you get the energy out of the food, to break the chemical bonds,
Mm-hmm.
that we have in our proteins, our carbohydrates.
Mm-hmm.
And so that's why, in the big scheme of things, it's important to eat not only your carbs, but your proteins and your vegetables. Vegetables are where our vitamins are stored for the most part. The interesting part, and you were bringing up about the fact that vitamin D kind of stands out a little differently, is that vitamin D, although we do get it in some of our foods, a lot of times it was initially more so about the absorption, that we get a chemical reaction that happens in our skin.
Mm-hmm. Mm-hmm.
So that's
Mm-hmm.
not common
Mm-hmm.
for most vitamins. Most
Mm-hmm.
vitamins are on intake.
Mm-hmm.
The vegetables and fruits
Mm-hmm.
that we eat
Mm-hmm.
get broken down, and they have vitamins in them.
Mm-hmm.
These vitamins help us to break the energy out of our food. But
Mm-hmm.
vitamin D,
Mm-hmm.
different animal. So
Yeah.
vitamin D actually in our skin, when the sun hits our skin, it gets converted into an active form. And that's probably more along the lines where there was more conversation about its hormonal role versus
Uh-huh.
its food role or its nutrient
Okay.
role in that way.
Uh-huh.
So, and in that role is one of the reasons why the deficiency has also become an issue as well.
So, Dr. Monica, first of all, I'm going to say, I love Afro descendant people. They are so freaking smart, because that was literally, literally, that was one of my questions about the absorption in the skin, right? So I like that. I mean, first of all, we always have synergy. Let me just put that out there. Like we just have always have synergy. But for you to even just now, in talking about the history and the popularity of it, talk about our, how it's absorbed through us, through our skin, that's very important. And so I just wanted to bring light to that and reiterate that what you said is that it is absorbed through our skin, right? And so you were saying that vitamin D is like the other vitamins are used as a coenzyme, correct? To break something down, correct?
Right.
So what is it that vitamin D is breaking down?
Well, when I say not breaking down, I mean used to build. You break down to build up. That's kind of how things go. Now, vitamin D is a little different. So vitamin D is a different vitamin, as you mentioned before, because it's almost a transporter. So you will see when vitamin D is talked about, when you see vitamin D in the stores, it's got a compadre, it's got a friend. And the friend that's always usually going with it is calcium. So vitamin D's job is to help us to absorb calcium.
Yes.
So that is different necessarily than what other vitamins do as far as breaking, in that coenzyme type of job. Is that it's transporting, it's helping to transport something that's very necessary. And people for years have known that our calcium levels have been very important in the prevention of diseases such as osteoporosis, rickets, osteopenia, osteomalacia. And that's kind of what has been vitamin D's claim to fame in helping to get calcium absorbed into our bodies. And that's kind of what we knew. But it was working behind the scenes, and there were things that still hadn't been enlightened about what vitamin D is. And that's the reason why I love the fact that you call it the diamond nutrient, because it's kind of the thing that's shining underneath. It's kind of rough. Because it is so important in other areas. It's become more important. It's become more studied because we have brought to light the fact that it is so important to so many areas, such as inflammation, anti-inflammation. It's so important in areas such as anti-cancer. But one of the areas that is getting its most shine right now is in our immune systems. Now, this is not a new job for vitamin D. We're just now shining the light on it. And COVID has really brought that to the forefront, because what they're finding is people who have higher vitamin D levels have been found to have stronger immune systems and have fared better when they've been looked at, as far as if they've been infected with COVID, that they have not had as bad outcomes. I was looking at some articles and that have been published in some of the larger journals, JAMA, Lancet, about just even African Americans, and that it's been shown that they have absolutely benefited from vitamin D, even more so than maybe some other cultures have, or some other races have, excuse me, in that they have fared better with their COVID outcomes if their vitamin D levels were higher.
Absolutely.
And so that's important. If we jump ahead, African Americans, people of darker skin, actually do have a harder time
absorbing
version of absorption of vitamin D
because of absorbing in skin. But Dr. Monica, Dr. Monica, so listen. Okay, so Dr. Monica, you're so, I always say this, you're so freaking smart, and I really don't say that lightly, like literally you are. And I get so engaged in you giving the information. I got to remember that I'm presenting this to an audience to help them understand. So I'm just going to go back just a little bit to talk about, you were saying that vitamin D is helping to absorb calcium, right? So, so would it be fair to say that before the medical community, if you will, spoke about calcium and your calcium depletion and those things, right? Yes. Because of all of those diseases that you said that the calcium depletion caused. Yes. But in current years, what has happened is that the scientists have discovered that, it's not just the calcium. It's because the D is deficient. And that's why the calcium is not working like it's supposed to work. You
can't absorb the calcium if you don't have the D.
If you don't have the D, right?
If you don't have the D, you can't absorb the calcium. But not only that, we talk about that, but let's not miss out on some other really key factors. The vitamin D receptors are on many cells. They control cell growth. They control inflammation. They control immune system. They control part of our glucose metabolism, how we break down blood sugar, how we break down sugar. It's on so many tissues of development and growth. So when we're talking about children and their development and their growth, let's not leave out that pregnant women need to be, concerned about their vitamin D level, because it's affecting their children's growth and development. It inhibits cancer, not only the production of cancer, but also can inhibit the growth of cancer after getting it. So it is truly proactive and active in many, many forms in our bodies. So it's a warrior. It's a warrior.
Look, it's the diamond nutrient.
It's the diamond nutrient.
The way that I came into talking about vitamin D, and I started off talking about specifically D3, and we'll talk about the difference in a second. But I did in graduate school at Georgia State, I did cancer research and breast cancer in women, right? And I studied this with an Afro-descendant or African-American woman, and what we found is that when that cell, right, was deficient, I had enough vitamin D that the cancer, it reacted differently, right? I always tell people that what I saw was that lining around the cell was smoother, right? Because it had vitamin D in it versus the one that didn't. It was more rigid. So the cancer was really attacking that cell more. And so that was my attraction to vitamin D3 for me at the time, is that if it is able to do this to this breast cancer cell, and we're not talking about it, right? We have got to start talking about it, because this is important. If it's one small entity that would help us to now either not get cancer, or if we have it, move better with it, I guess, if you will,
Treat
then
it,
we have to treat
yeah,
it, correct
yeah.
treatment, then we
Mhm.
have to know it. The other thing that we have in common, that we're both members of Delta Sigma Theta Sorority Incorporated.
Yes, yes.
And when I was online, they literally called me Miss D3, because I talked about, because people was tired and they didn't feel good, and I was like, your D levels are probably low,
Right.
right?
And that's something that we don't talk about enough. We talk about, hitting people with, vitamin B complexes and all of that.
Mm-hmm.
But I have often found when I do replace patients' vitamin D,
Mm-hmm.
they actually do feel better.
Yeah, you feel
And why
better.
would you not if it's that integral in so many different cells?
Yeah.
So, it makes sense that when your vitamin D level is low and you bring the level back up to not only a sufficient rate,
Mm-hmm.
place, but also a place where it is actually thriving, that
Mm-hmm.
you will feel better as well.
So the reason that it became popular then, Dr. Monica, is mainly because scientists now figuring out that this is what you need, because this calcium deficiency is because
Yes,
it don't have the helper to absorb, right?
absolutely.
And then
Absolutely.
now it becomes popular, because it was like early 2000s when we were doing the research. So that's early.
Absolutely. I mean, absolutely. Like I said, it has not always been on the forefront from a I am allopathic trained. In other words, I'm an MD, and
Mm-hmm. And what's allopathic trained?
so allopathic versus osteopathic. Like I'm the classic American physician trained, but my
Mm-hmm.
background has
Mm-hmm.
always, I was raised in a household, didn't go to doctors. I was
Mm-hmm.
raised in a household that we opened up a book called Garden of Eden and figured out what herbs and vegetables and things we need to throw
Yeah.
together to fix the headache.
Yeah.
And so I have combined those two mindsets into
Beautiful.
my practice. So that being said, my younger years of medicine, vitamin D wasn't something that we would test for. It
Mm-hmm.
wasn't something we were looking for.
Mm-hmm.
We just said, when you turn 50, let's put you on, some hormone replacement and hope for the best for these bones of yours.
Mm-hmm.
We didn't really talk about, are you vitamin D deficient?
Yeah.
And then when they started doing vitamin D and calcium replacement, we still weren't testing routinely. And it's not commonly tested routinely now.
Absolutely. It is not.
It still isn't. And so that's a problem. But for those of us who are dealing in the more functional medicine, naturopathic areas,
Mm-hmm.
we do look at this on a routine basis. And we do
Mm-hmm.
see that vitamin D levels are absolutely low in our communities across the board, across
Mm-hmm.
races.
Mm-hmm.
And it's a problem. And it's
Mm-hmm.
a problem.
And it's because just yesterday I was at an event, because people just always want to talk to me about vitamin D. Like it's always
You're the queen of something.
about pellets or vitamin D's. Like,
You're
well,
the
here
queen.
she comes.
Yeah.
and I'm just trying to have a good time. I really don't want to be in my science mind, right?
Yeah, right. Well, welcome to my world.
Just want to just be like, wait a minute, hold up. Is this gonna be before I have a cocktail or not? Like,
Yeah,
I don't want to worry
about vitamin D. I get it. I understand.
because for me, Dr. Monica, if I go into that mind, it instantly sobers me, right? That's how powerful the mind is. It instantly
Absolutely.
sobers me, because now, to me, I'm in this world. Now, I love doing what I do. Like,
Absolutely.
I love educating
Yeah.
about subject matters, but when I leave, I remember that if I see you out, I'm like, I don't want to ask you about this, but I want to ask you about this.
It's
I'm
okay.
gonna remember that note to self.
25 years in, I am absolutely used to church, supermarket, post
Here comes
office.
Dr. Monica. Let me ask her a question.
So
I tend to say to my friends, okay, I need your doctor hat today, right? So they'll know if I'm just calling for your friend, if I just need your doctor hat, because sometimes it's like, wait, listen, I need your doctor hat. And you too, Dr. Monica, I don't think I've ever publicly just said thank you for everything that you did when my brother, was in the hospital and eventually died of COVID. But
Yeah.
you literally helped me through the process and held my hand to just say, this is what needs to be done next. And, tell them, because he was in Mississippi, and no shade to Mississippi, but shade to Mississippi. And so, so for me, they don't know what they're doing. So I had to come to the person I knew that would give information that I felt comfortable to give to the doctors, right? And so thank you so much for everything that you did and to help just
Mm.
even with that process. And then when I got COVID, you know, you was kind of like, well, listen, you're gonna be fine, just do blah, 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 blah. You
Yeah.
know,
It is,
so thank
it's
you.
been hard, and I was happy to be there. We all have been touched in one way or the other, and so I was happy to be there for you, and I would do it again in a
Yeah, no, no,
heartbeat.
thank you. No, thank you so much. As y'all see, y'all, I know if y'all listen to me, you know, I love all the doctors, and you know, and I love all of them equally because all of them give me something different, right? To feel who I am and what I'm doing. So, you know, just thank you for that. So when we're talking about, I often say Afro descendants, right? Because you know
Mhm.
we're all over the diaspora, right?
Yeah,
And so you will hear me say Afro descendants more so than African Americans a lot. So
sure.
so us as African descendants, we often talk about the melanin in our skin. So one particular person said yesterday that. Well, you know, because our melanin, you know, it blocks the vitamin D, right? And although there was some truth to that, right, it
Mhm.
was not necessarily the truth. So if you can just correctly give us the information that we need, so we'll be able to say what our melanin is, because there's nothing negative about it.
Oh,
We're
absolutely.
not, it's not blocking anything and it's there for a reason. But when it comes to vitamin D and the absorption, you know, talk a little bit about that.
So, in general, what we always like to say, well, there's two different things. So if you talk about what the national public likes to say about melanin, it gets a really bad rap.
Yeah.
But those who have studied it more extensively understand that it actually, I could go through and tell you all the things that it prevents. We are not as a community, as a culture, and I keep saying culture, but I mean as a race,
Mm-hmm.
not as prone to osteoporosis,
Mm-hmm.
because people, those of us with darker skin are usually not prone to that. So
Mm-hmm.
there are things that it has absolutely helped us and preserved us
Mm-hmm.
for. Unfortunately, with vitamin D, that is one of the areas that we have found that we struggle in a bit more.
Mm-hmm.
And you have to think about it more so from the sun rays, and it's probably from a protective standpoint,
Yes,
truthfully.
yes, 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 yes.
Um, because the ultraviolet rays are not penetrating the skin in the same way that they are in other races. And so
Mm-hmm.
therefore our conversion abilities are less.
Mm-hmm.
If I were to, and I haven't done extensive research on it, but if I were to kind of extrapolate out from what I do know, I would say that it probably, if we were in our native land,
Mm-hmm.
there were probably better sources there
Mm-hmm.
for vitamin D that
Mm-hmm.
would kind of make up for the fact that we weren't getting things. Food
Mm-hmm.
is our first medicine,
Mm-hmm.
and we are so far from what is naturally good for us that
Mm-hmm.
that's probably why the deficiency is higher in us. Not because in any way that we are, in some way pathologically in tune with getting a vitamin D deficiency, but
Mm-hmm.
it does have to do with the ultraviolet rays not being able to penetrate the melanin and have it be useful in this
Mm-hmm.
particular case.
Mm-hmm. And Dr. Monica, and the fact that you said that, I keep telling you we're on the same page,
Yes.
but not to get off topic, but I often talk to people a lot about, because we're in this phase of and I'm gonna go to the right, but I'm gonna bring it back center. We're in this
Okay.
phase of this whole natural hair movement thing, right? And so in this phase of natural hair movement, I if you see me, if you watch on YouTube, you know that I normally press my hair out. And so but I'm natural, right? And so people say, you're not natural because you press your hair out, right? So
Right.
I say to them, and I'm going to tell you how I'm connecting this whole thing as you're talking to me.
Sure.
And, I say to them that, we were in Egypt and our hair was straight, but when we transcended into Africa, right, our hair had to coil to protect our brains, right? And so it became into that natural coiling state to protect us. So the same for our skin, as you
Mhm.
were saying, it is because the sun shine differently in the
Yeah.
East in Africa, right? Then we needed to now protect ourselves. And you know that the human body has its way for adaptation,
Absolutely.
changing to help you live longer, right? So
Mhm.
not only so from now what you're saying with the vitamin D is that in the melanin in our skin, right, is that not what I've just heard is that it's not only that our hair coiled to help us, but our skin darkened also to help us with, so we didn't have to deal with cancers and all those other things, like you said, osteoporosis and those things.
Right.
When we were in Africa, all these things were needed. And you also said that food, which was used more so as medicine, and now we're just eating for just to be eaten, right?
Yeah, yeah, well, true, true.
Yeah, and so it was used more so for fuel and medicine, and we've gotten so far from that. And so then we clearly, if we're raised and we've descended to where we are now, then we had to be getting the vitamin D,
Sure.
right, in
Right.
some form of what we needed. So
we don't have a higher episode of rickets or anything like
correct.
that. So,
and could you tell everyone what rickets are? Because I know that if you look at the history of vitamin D, that's where it starts, where they started talking with the higher cases of rickets. So if you could just tell everyone what rickets are.
So when you have a deficiency in a vitamin, there are different diseases that will come about. And vitamin D deficiency, we have seen definitely cases of rickets, which is a bone disorder, where your bones don't grow strong. And of course, like we just said, if your bones don't have enough calcium, and therefore because of the lack of the vitamin D, then your bones will, it happens usually in childhood. It's something that happens at a very young age. And so we don't see it a lot in this country because a lot of our food is fortified with vitamin D as well. So we talk about, and that's some history there too, because now we're all taking vitamin D supplements if you're educated about it. But our milk is vitamin A and vitamin D fortified. It's been that way for years, for many umpteen years. So we knew that it was necessary, but we were putting it in different ways. But rickets is one of the diseases that was prevented by fortifying our foods with vitamin D, so that bone disorder would not happen to children.
So Dr. Monica, so we've talked about the history, and we've talked about how vitamin D is absorbed. Let's now take the time to talk about, I told you when I started, we specifically did D3. And so I specifically talked about D3, but when we did recently in December, we did the COVID vaccination podcast, if you will, we talked about, people were talking about D2 also, right? So if you could just tell us the difference between vitamin D3 and vitamin D2. Is there a big difference, or is it the same? Because some doctors prescribe D3 and some doctors prescribe D2. So if you can just explain that to us, the difference and why they choose to do the different.
And I've had two different experiences with that. What I will say is, in my practice, I usually will use mega doses, and I call them mega doses because it's 50,000 units of D2 initially when I find that someone is deficient in vitamin D. And when I say I should say insufficient, meaning that they are like down below 20. So they're in the 9s, they're in the 13s. And
so I'm sorry, let's stop. Let's go back. Could you give us the range of normal and abnormal? Can you give that to us?
Absolutely, because that's actually a really, really good point. It's it's an interesting topic, and some of the topic that's in the news that some controversies around about what's normal. So basically the baseline, what everybody agrees on, is the number that everyone's trying to get to is 30. So in your conventional doctor's office, you come in, if your number is 30, 31, they're like, check, you're fine.
Okay.
But anything less than 30 is considered a deficiency. Anything, and so anything less than 20 is really like insufficient.
So listen, so that's real easy. So it's not like a range like the blood pressure and the diabetes. It's like real easy.
That's your number, but here's where it gets interesting. So 30 and below, you better do something about it. You better do something about it. At 30, conventional doctoring will say to you, you're fine, you're okay. But I'm here to tell you that there's an optimal level.
That's right, Dr. Monica. That's right.
That optimal level is the issue that we came to talk about today. And that optimal level is a range between 50 and 70, aiming for 70. why do you say why? What's the big deal about that level? But that's the level that we talk about. Yeah, you've hit 30, you may have, you've touched on that bone, that calcium, but I want to talk to you about the area where we get into that immune response, that immune protection, that anti-inflammatory effects. That's where you get into that level. And around 70, 75 is where that sweet spot is for most people. And so to get to that spot is when you have to really be on a daily basis, taking higher doses, usually. The average, when you look up the average dosage that should be taken by most adults would be around 600 international.
Okay, we're not gonna talk about that yet. We're not gonna talk about
we're not going there
right here. We're gonna stay right here. We're gonna get to that. We're gonna get to that. We're gonna get to the international units. We're gonna get to that. But I want you to talk more about this baseline and this optimal balance, because that's what I talk about all the time, is that you just don't want baseline, because really baseline is just survival, right? That's just survival, right? But you want optimal balance.
Who wants to just be normal?
Who wants to just live an age and not live their best life while they're living?
Absolutely. Right? And so here's the thing, like, I don't want to just be getting by.
Yeah.
It's getting by. And this is my new thing for my new clients, is to tell them, getting by gets you sick. Getting by sets you up for long-term health illnesses. It's almost as if you just are, you get the slip in the mail that says you got your labs and everything looks okay, but you don't have any information. You don't have any education about how close or how far you are from optimization. And you really have nothing but an average report. And you really don't know if you're really doing great, if you're doing preventive things for yourself, or you're just getting by. So when it comes to vitamin D, 30 is getting by. You want to be in a place that's optimal. Optimal gives you not only benefit today, but benefit for the future. And isn't that really what we should be trying to aim for in all of our health? Prevention, not just I'm okay for today and let me go out and keep doing what I'm doing until it breaks down. We don't ride. We always talk about we're gonna ride it till the wheels fall off. We really don't want to ride it till the wheels fall off.
Right.
We want to take it in for some checkups.
Right.
We really want to put some oil in it.
Right.
We really want to rest it when it needs to be rested.
Right.
Change the tires when it needs to be changed.
Right.
That is not right.
And then the wheels won't fall off.
Right. Won't fall off. Let's take
if you're doing the maintenance.
Exactly. And this is what these kind of conversations about vitamin D maintenance, vitamin D, optimization is really. Let's take care of it, because if we take care of it, it will take care of us.
Yeah. Dr. Monica, when you listen, I always say that, first of all, I know I do this, I'm a public health educator, and I literally do this for everyone else. But every show, I promise you, if you're open to learning, and for me, I'm a forever student. I'm very studious. I'm a forever student. I always say that, right? And every show I learn something different, and I may have heard it, right? But when specific people say it to me, I hear it differently. Like, I literally talk about the optimum balance, but a big thing about Blackpink is that we say, in order to be better, you have to know your numbers, right? Yes. So know your stats. And so in everything, like you said, there's a baseline, right? There's a baseline to just living, just waking up every day, just laying in the bed, living, right? Right. There's optimum balance, and that is where you want to be to help be proactive, if you will.
Correct.
With a lot of things that we have going on. So you said the baseline, right, is if you 30 and over, you good for baseline. And if you're below, you're going to have concern. If you really below 20, then you're really deficient, right? Absolutely.
And really will benefit from getting just a baseline, but that shouldn't be your goal.
That shouldn't be your goal, right? Correct. And then for optimal balance, which we talk about a lot.
Yeah, optimal.
For optimal balance, this is the balance to be proactive, right? Correct. We need to be between 50 and 70.
There you go. That's the ticket. That's the golden numbers.
Yeah.
That's the gold numbers.
Yeah.
That's what
And that's easy. That's easy. Just remember when you go to the doctor and they tell you this baseline, you let them know, I want to be at optimum balance. And if that doctor, then this is what I say, if that doctor isn't talking to you about optimum balance, that isn't the right doctor for you.
And
You want a
I
doctor.
agree. I agree with that. And I
Mhm.
think that doctors get really sometimes upset when patients Google and do things like that. And if you
Mhm.
are in that situation, you're probably not in the right place, because this is
Mhm.
a conversation. And this is,
Mhm.
at the end of the day, your health.
Your health. That's right. That's what I
It's
say.
your health. We're talking
Absolutely.
about your health. They don't own it. We don't own it.
Yeah.
You own it. I
Yeah.
own mine. You own
Yeah.
yours.
That's correct.
And so if I go into a store and I bring my car in and somebody tells me, well, I'm not going to talk about what you want to talk about your car,
Yeah.
then I'm leaving, because I
Yeah.
came here to talk about my car.
Yeah.
It's not that the doctor, you own the doctor. It's a
Yeah.
dialogue.
Mhm.
They
It's a
may not,
partnership.
it's a partnership.
Mhm.
They may
Mhm.
not have the same thought process as you, but they should
Mhm.
be willing to have a conversation, and there should be some
Mhm.
education going on. At the end of the day, I learn so much from my patients as they learn from me,
Mhm.
because they bring in interesting facts, and sometimes I have to go look it up and
Yeah.
see whether or not what they're bringing me is good facts or not good facts.
Yeah.
But it's a conversation, and those
Mhm.
relationships that I have with patients are priceless for me and for them.
Mhm.
So if your doctor's not willing to have a conversation, or at least get into dialogue about what is individually best for you,
Mhm.
you might not be in the right place.
Yeah. Yeah. And that's from Dr. Monica. Okay, that's all. Okay, that's all.
No,
That's
but
all I'm gonna say
really,
about that.
yeah, no, really and truly, as
Yeah.
a physician, I'm giving you permission
Yeah.
to ask a question.
Yeah, absolutely. No,
Don't
thank you
ever
for
let
that.
anybody do anything to you without you being able to ask many questions until
Yeah.
your answers are answered. And this is not their body. This is not their life. It is yours,
Mhm.
and you
Yeah.
are putting it in their hands. And so therefore they should treat it with respect.
Yeah, no, Dr. Monica, you're absolutely correct. That I say that that's the main goal in me doing the podcast, is
Mhm.
that I want to empower people so when they go to the doctor, they won't feel intimidated and they'll feel like they are comfortable enough to answer questions. And the only
Yeah,
way to do that is to educate yourself and
absolutely.
empower yourself and write the questions down and ask the questions. So thank you so much, because I can say it 1,000 times, but actually coming from an actual MD
Yeah.
puts a lot of weight on it. So thank you for that. So
Mhm.
if someone is feeling like they are, oh, okay, no, I'm sorry, let me go back to this, the difference between D and 3. So with D and 3, you were saying that with
Oh, yes.
when you want to give a big dose, you normally do the D2 because you can give it at a higher unit, right?
Correct.
Um,
And then you are right. I did not finish my statement on that. The D3 is what I usually use for maintenance, and so it is
Okay.
much. It's easier to absorb. The D2, I find people use that a lot for some other medical disorders as a treatment. So it's kind of
Mhm.
almost like it's an initial boost, but it's
The
not.
D2 is.
D2 is, but the
Mhm.
D3 is a maintenance
Mhm.
dosing. And you can get D3 in 50,000 units. It's just
Mhm.
not used commonly, but you can get it in 50,000 units. You can also get the D3 in liquid form. You can
Mhm.
get it in tablet form,
Mm.
little gel tablet forms, or capsules or tablets, excuse me.
Mhm.
And patients usually end up taking that after they've gotten to that level, that optimal level,
Mhm.
daily.
Yeah,
It's a
that
little
was actually
confusing, right?
literally one of my questions,
Yeah, it's a
is
little
that
confusing.
once you get that balance, how do you continue it?
Yeah.
How do you sustain it, if you will? And so
So a lot of people will feel like, well, once I get there, then I'm done.
yeah,
And it's not, it's a deficiency. And the
yeah,
same way you got deficient, if you
yeah,
stop taking your vitamin D, you will become deficient again.
yeah.
So you do have to kind of be okay with the fact that it's just one of those things you're going to be taking for the
Yeah.
rest of your life.
And there's nothing wrong with it, because it's a vitamin, it's not going to hurt you. And so since we're talking about this, if what if you have to, and I'm going to go back, but since we're here, since Dr. Monica took us here, we're going to talk about it. But how do you now, is there a certain thing, my mom actually asked me today when I was telling her I was doing the show, was like,
Yeah.
well, can you get too much vitamin D? So that's the question. Can you get too much vitamin D?
There's toxicity in vitamins,
Mhm.
fat soluble vitamins, which vitamin D is one of the fat soluble vitamins, which means that it can be absorbed into your fatty tissues and live there. And therefore, if it can live there, when I say live there, it can stay there and build up. And if it can stay there and build up, then there are forms of toxicity that you can develop. Unlike water soluble vitamins, which are more along the lines of your B's and your C's, they will actually, you'll get rid of them when you urinate. And so you kind of can have really high levels, but the body gets rid of what it doesn't need. So yes, you can have very high levels that can make it toxic, but the studies have shown that with a daily allotment of 10,000 a day, you still have very hard times finding someone who becomes toxic at that level. So yes, it is possible, but it does not happen very often.
Does not happen very often.
Yeah.
So it's possible, but it doesn't happen very often. So
Absolutely.
get that out of your head. You're probably not gonna OD, if you will, on vitamin D. It won't be the thing that takes you out. Look, it won't be the thing that takes you out, right?
And I would suggest that, if you're taking vitamin D supplementations, or if you're not, but once a year, please get your levels done so you can see where you are. I have yet to see anyone's level over 100. And so therefore I would tell people, please, you're better off taking your supplement than not. And let's throw in there, there are some other advantages. I do want you still to get out in the sun.
Yeah.
The sun gets a bad rap, but getting out in the sun 5 to 30 minutes daily if you can, with your skin uncovered, as long as you don't have any kind of major skin issue or skin condition, is still important. And that does still bring in the conversion at some level. And so we never want to write that off as not a possibility.
Dr. Monica, don't you agree? Now, this is a sidebar conversation because, I was biology chemistry also and in biology chemistry masters. But if they just would have told us about this photosynthesis in a way of something that was relatable, right? And that you need this sun and the photosynthesis and the breakdown of vitamin D in your skin, man, we would all just have all hundreds in the freaking class because it would have been so freaking relatable. But no, that's not what you do. Like, you make it so complicated. We got to draw it out. You know what I mean?
All related. The plants and the animals were all related. We all need this thing. We all need this out there. And so, just making it plain, as my mother.
Yeah, making it plain and relatable to who we are. Like you can, like, to me, you can start there and then digress and get the whole breakdown and draw it out and just things that I didn't even remember. Yeah, as I was like doing research for this because even though I did the research in grad school, I wanted to be current on what's out there today, because how science changes.
Things change. Yeah.
She's saying everything that I read, so I'm like, this is so freaking smart. So, Dr. Monica, so let's talk about people who are feeling deficient. Like, so tell us some symptoms. Tell us, like, how do you, like, if the moment people tell me that they feeling tired all the time, I'd be like, you're probably vitamin D deficient. If they say I'm really not sleeping all night, I'd be like, you probably need to get your vitamin D3 D levels checked, right? So how do you know, right? If you're not going to, you should be going to the doctors. I tell people all the time, you should be getting your annual checkups. You should be, if you have hypertension, you should be getting your blood pressure and your glucose done. If you are diabetic, you should be getting all those things done and maintenance, right? But how do you know if let's say you've had your yearly exam, and like you said, all doctors don't check your vitamin D levels, right? And your doctor didn't check, and so you just had your exam in let's say March, right? And now it's April, and you start to feel what feeling are you feeling to as a doctor to say, I should check your vitamin D levels?
That's a really great question, because I will tell you, most people who are deficient in vitamin D don't know of a symptom that they're looking for. But I will tell you some of the things that are off the grid that you may not think about. So fatigue is one of them. Fatigue is one of them. Another one very interesting that I developed and was an education for me is sternal pain.
Sternal pain.
Sternal pain. So your sternum is the bone that connects your ribs together, and it's right here in between your chest. So your chest bone. If that's tender to touch, you probably have a vitamin D deficiency.
Wait. Now, if you think you might be having a heart attack, like you may be
No,
having a heart
no,
attack. That's not what she's saying. That's not what she's saying.
internal. I'm not talking about internal pain. I'm
Mm-hmm.
not talking about chest pain. I'm
Mm-hmm.
talking about you press on your chest and it
Sensitive to
feels
touch,
like,
maybe.
right, it feels like you
Mm.
have some tender spots. It
Mm.
feels like maybe you got hit there, and it just never goes away.
Huh.
That's actually can be a sign of vitamin D deficiency.
Why is that? I know you can, and I
So
know we have
that's a
like,
great
why
question.
is that? Do you know?
And I don't know the actual the mechanism behind it.
Mm-hmm.
It may be coming from the fact that it's a pretty nice sized bone, and maybe there is some calcium that's being drawn out of that bone
Mm.
that is causing it to be more sensitive. I honestly, that's just
Yeah,
me.
but that makes sense. But okay, okay.
It's a
Mm-hmm.
pretty nice sized bone, and
Mm-hmm.
that may be why. Um,
Mm-hmm.
the other thing is depression.
Mm-hmm. Mm-hmm.
Depression can also sometimes be presented as a vitamin D deficiency.
Mm-hmm.
Um,
Mm-hmm.
but there's not a whole lot of pain that necessarily comes along with this.
Right.
But those are some of the three things that I would think of: fatigue, that
Mm-hmm.
sternal bone pain, or that
Mm-hmm.
sternal pressure pain, and depression are the ones that come to my mind that
Mm-hmm.
maybe put you in the mind of it. But you brought up a good point about the you had your physical and it wasn't tested.
Mm-hmm.
Please don't be afraid to ask your doctor to test for
Mm-hmm.
vitamin D, because I would dare
Mm-hmm.
say the vitamin D deficiency is so prevalent that if
Mm-hmm.
you ask your provider to test you for it, they're probably not going to fight you. They're just
Mm-hmm.
going to be like, oh yeah, didn't think about that.
Mm-hmm.
And let's go ahead
Mm-hmm.
and do it, because
Mm-hmm.
it definitely will probably come up positive.
Mm-hmm.
And they'll
Mm-hmm.
want to treat it once they find it.
Mm-hmm. So fatigue, low energy, you're not really feeling like getting up, and which also ironically goes with the depression, right? You're not feeling like getting up. You may most oftentimes than not, you're probably vitamin D deficient, and you
More
need
than,
to
yeah, more than
get some
likely.
supplements.
More than likely. I mean, there's also anemia. There's definitely other causes for,
Yeah, yeah, yeah.
for that. But it's one of those things, if you're going to get a CBC to check for anemia, you should be checking your D level as well.
Mm-hmm, mm-hmm. Okay, so now we've talked about the history, we've talked about the absorption, we've talked about the difference between D2 and D3, and so we talk about how you feel, how you may feel to know that, hey, I should go to the doctor. And it
Right.
doesn't matter if you got your physical or whatever months ago. If you're feeling this way, you go back to
Yeah,
the doctor and you let them know you're feeling this way, because you shouldn't have to feel that way. You should feel
absolutely.
good.
And
Like,
it's one of those things that if they're like, well, the rest of your tests look fine,
yeah.
go ahead and ask for that, because that could be the key. And remember that it's not just about how you feel today. What other things are you benefiting from if you have a low? If you have a
Mm-hmm.
30 and they're like, you're fine, your level is 30. Well,
Mm-hmm.
listen, I want to be optimized. I want to
Mm.
be 50 or 70. So,
Mm.
that's it's still treatable. It's still treatable.
Yippee.
And guess what? Between 50 and 70 may take care of that fatigue that you're talking about.
Yeah. Like Dr. Monica. So yippee, because I was gonna ask, the question I was gonna ask was, so what if the doctor said, well, no. I don't think your vitamin D levels are sufficient. It's okay that you say, well, what are my numbers, right?
Mhm.
Like, what are my numbers? Like people be nice about this situation, because
Right,
my
yeah.
grandmother said you can get what do they say about the bees
More
with
with
honey? What do they
honey,
say?
more with honey than
Yeah,
vinegar.
more than 100. Yeah, yeah. Of course, right. Of course.
Be nice to your doctors. Don't
Yeah.
beat the doctors up. They're doing
Yeah.
their job. They're
They're
trying.
doing their job. Right, right. Of course, be nice in your approach, but absolutely ask what your numbers are. And if
Yes.
they're saying
Your
it's
numbers.
30, say, hey, I want to have optimum balance, right? And so I want to be in the 50 and 70 range. And
Right.
so I just want to feel better. And they should be able. And so if you go and you tell the doctors this, what is the next step that the doctor should do? Let's just say they've already tested you, right? And they
Yes.
see that you're at 30 and you say, hey, I want to be 50 or 70. What should they do? But before you answer that question, let's go back and say, let's just say they say you at 20,
Yes.
right? And below. What should be the first step then that they should do?
At that point, they should be offering you some form of replacement. And more than likely, they can either in office, they can do
Mm-hmm.
an injectable form of vitamin D.
Mm-hmm.
Or they can put you on a prescription of drops, or they can put you on a prescription of oral.
Mm-hmm.
The oral would have to be, once again, 50,000 units, or the injection would be 50,000 units.
Mm-hmm. So then the injection then is D2 also.
It is. The injection would be D2 as well. And the gel caps would be also ergoferol or Dristal would be a gel capped capsule, but they would be 50,000 units. Yes.
Be 50,000 units. Okay. And so it's probably D2. Okay. And so they're going to put you on that. And how long does it normally take to get to just the baseline? Let's just get you to how long does it take to just get you to baseline and say if you're at 20?
Well, we usually give you 2 months. Give you 8 weeks of that therapy, and then come back and check your level again. So don't go back.
I'm glad you said
don't go back to your doc every week and be like, check it now, see what it looks like.
Yeah.
Give it 2 months, stay on the therapy, see where you end up. And at that point, it's time to make a decision, clinical decision of whether or not you should stay either another round of 50,000 or doing it. Sometimes I've had to do it twice a week instead of once a week. Or if you're fine, then we may be able to go to the orals at that point of D3 at 5,000 or maybe 10,000. If you are, let's say for some reason you are prone to have really normal or high D levels, you may be somebody who can take some of the lower dosages of 4,000 and things like that. It is based on the numbers, but what we're talking about for the majority, we find that they really do need to be in the 5,000 to 10,000 range. But the good thing, it comes in variable dosages, and so you can find the one that's right for you.
Dr. Monica, so you also said when you were talking about the difference between D3 and D2 is that with D2, so they're both pretty much the same, except you can give one a higher dosage than the other.
Basically, and how it absorbs and the way, the efficiency of how it absorbs for what it's used for. But they both can be used. But I would dare say the D3 is a better choice for maintenance.
For maintenance. So I think that back in the early 2000s, they mainly was just talking about D3. And so that's why I've always, like literally till this year, until we did the event with you, that I just always like, get your D3 levels checked, get your D, when really it should have been get your D levels checked. And it was literally from you that I learned, because someone told me that, well, no, I'm sure my doctor prescribed, because I said, are you sure they prescribe D2 and not 3? And she's like, yeah, no, I'm looking at the bottle and they said it's D2. And so, and that's when I brought that question to you, so we can address it and say, hey, like, is there a difference? Like, why did she prescribe that? So now we know. So today we've learned that if you want to have it at a higher dosage, right, to get a big bang for your buck, right, to get more in you, we do the D2. And then for maintenance, we want to do the D3. So we've talked about the amount of international units, or the IUs. That's what everybody see at the bottle, and they get, I had somebody tell me just like, oh, she gave me all these things and she didn't even know what it meant. So that's why the importance of doing this show. And she's like, I'm not taking it. And I said, well, that's why you're tired now and ready to go home, because you're not taking it.
And guess what? It's so funny because you get kind of caught up in the numbers, and that's with medicines and supplements in general. I tell patients, please don't look at the numbers. You won't probably interpret them correctly. Something could be a 0.5 and knock you off your butt. And then something be 2,000. Mild. So really seek out a medical professional who can really interpret that for you. And then there's different ways, and that's just science and whatnot, because you could discuss vitamin D in milligrams, discuss vitamin D in micrograms, and then you discuss them in international units, and they can all be equivalent, and they all sound totally different. There's like 125 micrograms would equal out to 1,000, I think, units, if I'm saying that right. So and then 250, I think it's 2,500 if I'm saying that right, and then 250 micrograms is going to equal out to 5,000. So in other words, my point being that if you try to interpret the number of it, you're going to get confused. So I like to speak in international units, because that's kind of a universal language. And then that way you don't have to try to calculate out what you're getting.
1 microunit is 40 IUs or something like that. You don't have to do that math.
So just be very careful that when you're trying to make conversions, that you don't convert it wrong and think you're taking a whole bunch, and you really aren't. You really aren't. You're just taking a little bit, not even close to what you need to.
Dr. Monica, I've literally, I say, I knew I had all these things to do today, and I told you I had a lot to do, but
Been
you
busy.
said earlier that when you do what you love, it doesn't seem like work. So
That's
I
right.
didn't care how much I had to do. I was looking forward to doing this vitamin D show because I want to empower people. And now I'm just going to say, go watch the show. Like, right. So now when I'm in a function, I'm like, go listen to the show or go watch the show.
Yeah.
Like it's on there. And it's going to be everything that you need to know because we've covered all things that you need to know about this diamond nutrient. And so if vitamin D is vitamin D given on your weight or just your deficiency?
You know what? I see what you're saying about us being on the same page.
Yeah.
Because one of the things I didn't want us to walk away without saying is like what would make someone at risk for vitamin D deficiency.
Yeah.
And you know, there are some things that make some people need vitamin D more than others.
Yeah.
Weight being one of them. So the more adipose, the more fat cells you have. Remember, I talked about vitamin D being fat soluble. You actually may need more vitamin D, or you may not. You're like, well, I'm taking my 10,000 and it's not working. Why is it not working? My sister or my brother takes it and his level is out the roof. If the more adipose that you have, the more the vitamin D will.
You keep saying adipose. So what's adipose? So since you
Adipose
keep using it, let's tell us what it is.
And I use that word adipose because I'm trying to be
not use the word FAT.
Fat, right? Who wants to hear the word fat? The more adipose.
But you gotta have to when we talk it to Afro descendants who are stubborn and stiff-necked, we gonna have to say what it is.
Yeah, the more fat we have,
fat, right?
Unfortunately, we can have a whole conversation about how much risk factor that brings on from multiple things, especially based on where it's distributed. But in general, your vitamin D may be absorbed into that adipose tissue, that fat tissue, and stay there, and so therefore never get into the bloodstream where it needs to get to really get to where the source of that it needs to be in, which is the cells. So you may be more if you have a higher fat level. There are other medical conditions as well. If your colon doesn't absorb well, if you have colitis, not irritable bowel, but colitis, what am I trying to say? Crohn's disease or ulcerative colitis. You may have issues with absorption, and that may be a problem. So there are definitely other medical conditions that would get in the way of your ability to absorb. So you say, well, I'm taking my vitamin D, but it's not working as well as somebody else's. That would be the reason for it. Cystic fibrosis is another disease process that we found because of the blockage and the poor absorption in general, intestinal, that you have vitamin D issues. I did want to also mention that as we get older, age is not one of those things that causes us to not be able to absorb vitamin D.
Age is not.
It's not. It's not. So no one is too old to get vitamin D replacement. No one is too old to take a vitamin D tablet. You will always be able to absorb it, and that's really important to know. It is not a barrier for getting your replacement done. And so that was a really good answer that you gave on the weight. Yes.
And needing more, because people always want to try to prove you wrong to what you're telling that's going to help them, right? But like, well, I've been doing that and that didn't help, right? Like, I've been doing that. So, but it's important to talk back with your doctor about it's not working, so they now can come back to the table and say, well, this is what's going on, and don't be afraid to ask those questions so you can get the answer. But Dr. Monica just told you,
yes,
that, what do you say? What do you call the fat cells?
Adipose.
Adipose. Spell that, because I promise you I'm gonna use it. What is it?
ADIPOSE.
Okay, adipose. That's what I thought. Okay, so adipose, and adipose means what?
It means fat. It is the medical term for fat.
Okay.
So you have adipose cells.
Okay.
And, those are just fat cells.
Can I start saying adipose?
You say I have a lot of adipose. They'd be like,
I have a lot of adipose. Okay.
Oh, really?
Well, I gotta go get rid of my adipose.
And you're still cute. Will you say, hey, listen, you get rid of some for me too. Have a good day.
No, you've now taught us a new word. I promise you, I'm gonna incorporate it
You know,
into.
we try to meet everybody where they are,
Yeah.
but we also want to educate you at the same time.
Yeah, yeah. No, Dr. Monica, I mean, I really, really appreciate the information. And I know there are several topics that you can talk about. But Dr. Monica, if you the diamond nutrient doctor, that's just what you are. Like, you know
Yes,
what I mean? Whenever there's a big conference that I'm going to be having, which I'm going to be having, we're going to always talk about vitamin D. And I'm going to tell you, you may say, well, I want to do something else. So you may do 2 segments, but be clear, you're going to be doing the one on vitamin D.
well,
That's just,
I do have a few other tricks up my sleeve, but
yeah, yeah, you
I
got a
will
few.
never run from the vitamin D talk. But no,
Dr. Monica, they'll remember that, Dr.
great
Monica.
topic. But I appreciate your interest in this one because I do think that it does and has been under talked about. So I'm
Mhm.
never shy about having a conversation.
Yeah, you got a lot of tricks up your sleeve.
I do.
As I'm sitting here, I'm almost just want to jump up and down like this. She's so freaking smart. Like my God, she's so freaking smart. I'm just so
I just enjoy what I
excited.
do. I just enjoy what I do. I
Yeah.
love talking about this kind of information, and I love sharing information so people not only, hey, listen, not only that you can listen, but you can go teach somebody else. Hopefully,
Yeah, yeah.
share
No,
the
no,
news.
absolutely. That's
Share the
that's
news.
that's the goal. So, Dr. Monica, I have taken up enough. It took a lot to get Dr. Monica on the show. And she talking about she got a lot of tricks up her sleeve. She's not just treating people with vitamin D. I mean, it was really hard. I say sometimes when I had the therapist on, we would record because my shows are pre-recorded. We would record at 9 o'clock in the morning, and I would be like, I have my coffee. It would be 9 o'clock in the morning. I would have so much energy. She would be like, okay. I was like, good morning. So now we're late at night, right?
Yeah,
So, because for me, the thing I like about the pre-recordings is that I am able to meet the doctors where they are
yeah.
because you're coming over here to help educate, and you really don't have to do that. So, with that being said, Dr. Monica, please, because people are gonna want to know how to get in contact with you. And are you seeing different populations now? Because I know at one time you were just seeing older populations. So are you
Yes.
seeing a different population at this time?
Yes, I'm so excited. Thank you so much for bringing that forward. Yes, for a period of time, a short period of time, I was only seeing our Medicare patients because of where I was employed. And I
Mhm.
so missed working with all age groups. I am passionate about working with adolescents.
Mhm.
So I'm spending quite a bit of my practice doing that, as well as working with all other age groups. I functionally, I focus
Mhm.
on women in trauma. I focus on women who are transitioning, who are wanting to
Mhm.
make change in their lives. I
Mhm.
focus on teens who are going through their transition, who are
Mhm.
having challenges growing up, having
Mhm.
relationships and having health issues at the same time,
Mhm.
relationships being with their parents or with their friends. And then I also, of course, can never stop working with chronic disease patients,
Mhm.
such as diabetics and patients with hypertensive.
Mhm.
In the format that I work with patients now, I'm able to really sit down and spend time evaluating what the root cause of their illness is, going back to
Mm.
a history of what their childhood and all those, and let's talk about why you got to where you are, and then
Mhm.
having a plan that has been designed just for you
Mhm.
to get you out of that space, get you
Mhm.
off medicines if at all possible, get you in a healthy space. And then, there's always that patient that doesn't have any of those problems. I love
Mhm.
those patients too, but they
Mhm.
want to get well, they want to stay well, they want to be proactive and prevent
Proactive.
disease. So
Mhm.
those are my wheelhouses that I'm in right now, and
Mhm.
loving all of that. And so I'm really accepting all types of patients, but those are
Mhm.
the areas that I really am passionate about.
Mhm. Dr. Monica, so deeply rooted, right?
Deep Rooted Health
Deep rooted.
LLC.
Mhm.
Deep
Mhm.
Rooted Health, Deep Rooted Health LLC. That's my baby.
Mhm. So, and if people wanted to make an appointment, so Dr. Monica is in the Atlanta area, correct?
I am. I'm also I'm also still licensed in the state of Georgia, well, of course, and the state of Louisiana and the state of Texas. I do and will be doing virtual appointments as well. So I'll be offering my services there. If you wanted to reach out, I have a website. My website address is www.deeprootedhealth.org. And that is www.deeprootedhealth, long word, but Deep Rooted Health, no space, .org. And you can reach out me on my website and make an appointment, ask questions. Just come see me. And then you would also email me at my admin at deeprootedhealth.org as well. And would be happy to get back in touch with you and find me on Facebook on Deep Rooted Health. And you can also find me on Instagram and LinkedIn on deep_rooted_health.
And Dr. Monica, as in all of our Black Pink advisory team, will be listed on our website and on our page. And if you wasn't able to get all that information, you can get it from me, and let her know that Black Pink sent you. And Dr. Monica, I was saying that the importance of us doing this show, because people all over the world are listening to us because they want to know information, they want to empower themselves. And I like that people are wanting to empower themselves and learn, so they can not just live to be 90, but have an optimal life at living to be 90. That's the main reason why I do what I do. Thank you so much for coming on here. I have so enjoyed just having you on here. And Dr. Monica, I know that, listen, here's some good news. I asked you when I started this program about being my capstone person, whatever I needed for, and you was like, yeah. And it was like, well, she never came back to me. I have two class, after this class, I have 2 classes left before I start my capstone. I just learned it today. So that has been my exciting news. Like, oh my gosh.
Well, I'm excited for you, and I can't wait. My door is always open for you.
Absolutely.
So anything that you ever need,
And I'm gonna come on a field trip to your place. And see you in action, so that people can see you in action. And they can come on over to see you. Look, I always say the doctors, the advisory team here is so good. You better get in for your appointment before they get so booked where you can't get in for the appointment, right?
Exactly.
So if you're looking for
everyone,
and Dr. Monica, you are family medicine.
So I am board certified in family medicine, but I'm also now getting certification in my functional medicine and integrative health. So I am expanding my repertoire of functional medicine and getting certified as a functional medicine specialist as well. So I'm enjoying that process as well, because I do use all of those techniques as I make my evaluations.
Thank you, Dr. Monica. That's great. Look, Dr. Monica is still learning. See, that's how you're a smart chick. You want to stay current. You still learning, so Absolutely. You can be able to be the best and help us be our best. Thank you so much, Dr. Monica J.R. Williams Riley.
Oh, thank you so much. Thank you for having me. It's been a pleasure as usual.
I look forward to working with you again in the future. You have yourself a wonderful night.
You too.
Okay, bye-bye. Oh my gosh, this has been so good with Dr. Monica and vitamin D and the things that she's been telling us about vitamin D. And so I am going to, without further ado, I am going to get to this next part of our, I don't know why this always happens to me when my speaker aisle is, for a while, it doesn't want to play my music. I don't know why it does this to me, but we gonna get it right. What this speaker doesn't do. I gotta see why this speaker does this. I don't know if it's me. I don't know if it's user function. I don't know, but let's just see if I can get it to. There we go. It's working. It's working. So today, my soul note is, I always say, I'm gonna help you breathe. My soul note person today is Algebra Blessed. And I'm featuring specifically her album called Recovery. Algebra has been in this business for a while now, and she is on all social media as Algebra Blessed, and that's ALGEBRABLESSETT. She's Algebra Blessed on all social media. She is also, website is www.algebrablessed.com. She is based here in Atlanta, Georgia. Algebra is also an independent artist. So I love featuring independent artists, although some people may not be independent. They're really, really good, and I want you to know about them. So Algebra is has done several albums. Go to her website, check her out. This is one of my favorite songs off um, her album called Recovery. It's called Danger Zone. So go check her out. Tell her that Kai sent you. And I also want to say that Algebra, I was intended to bring it with me, but Algebra also is doing lipstick. She has a lip bar line. And the color that I wear every podcast is her color, this matte red here. And because it's my favorite and it's a part of my podcast colors. And so I wear this color. So you can you can check her out for her lipstick also. Um, on her website. So tell her that I sent you. Check her out. You can download her on all musical platforms, and you will enjoy Algebra and all that she has to offer. And let her know that Kai sent you over to her. So today, oh my gosh, today has been so good. Vitamin D. I used to say vitamin D3, but today we have learned that it's not just three, it's two. So we say vitamin D. And Dr. Monica has told us a lot about vitamin D, which I have started calling the diamond nutrient. And one of the things that she told us is that your baseline should be 30 and above, and anything below 30, you're deficient, meaning you need to take some supplements. And to have optimum balance in which we all should be trying to have, you should be at 50 to 70. She also taught us the difference between D3 and D2, and when she told us that if you're very deficient and you need to get a big boost, you would give the vitamin D2 because you can give it at a higher unit or international unit, what we learned, like up to 50,000. You can give a lot. And then once you've gotten it to optimal balance, and then you can start for maintenance at using vitamin D3 that you don't get in such a higher units as international units as D2. It comes in like 1,000 and 5,000. So every day you should be taking some vitamin D, either the D2 because you're deficient, or the D3 for optimum balance for maintenance. This has been a great show. I talk about this vitamin as you heard all the time. Make sure that you're telling your healthcare providers to test your vitamin D levels. Make sure you're asking them what your numbers are and letting them know that if they say you're fine, say what's fine, and let them know that, hey, I want to be above 30. I don't want to just have baseline. I want to have optimal balance. And remember, we repeat what we don't repair. Now, that's a statement that is really, really important in tonight's, or I should say, in today's podcast, is we repeat what we don't repair. When life moves fast and your mind does too, remember to breathe. It will get you through. My name is Kai Ienta. I am the soul of public health. I am loving educating you in our vaginal health and sex series. And today's topic of vitamin D, the golden or the diamond nutrient. Until the next time, take care, take care of yourselves, live an optimal balance. Bye bye.